We are back here on Carolina Women. We are here with our friend Cathy Ulmer, one word, from Ulmer's Pharmacy, and it's always fun to talk with you. Jessica and Maria and you and I have been chatting. It's been really interesting. We've been talking a lot about flu season this year, cold, flu, sinus infection. Share with us a little bit about what you're experiencing.
So I think it's a record year for the earliest that we've seen flu. It started very much in September, maybe even a little bit in August this year that we were seeing flu cases. So
like no joke flu.
Like no joke flu. Like we are testing.
Okay.
We're swabbing and testing. So you can go to the doctor's office and you can get just like COVID tests. You get swabbed. You can tell whether it's flu A or flu B because there's two types of flu. I can't say which one is more prevalent, but I think the A is not as bad as the B, but we're seeing...
Symptomatically what it is it, because I think of the flu as like respiratory things, but you said it's...
So the flu is kind of all over the place. So normally you are gonna see some kind of congestion, like head congestion, maybe a cough, maybe some chest congestion, but you also see those aches and those pains and that tiredness and just fatigue. Some people just have had fatigue this year. Like they're just like, I cannot get out of bed. Almost like they thought they had mono.
Exactly. Okay, got it.
So that's extreme. There's also the diarrhea and vomiting.
I was just going to say,
we're not seeing, or I'm not hearing, I don't know, I'm not in the doctor's offices to hear a lot of the symptoms, as much, but we're not seeing as much of that vomiting, diarrhea. Again, I think we're seeing more of just general fatigue. Fevers and kind of just like congestion and a cough.
Maybe this is a question we should ask because we were talking about schools and missing days and things like that. When do I keep my kid home from school? Boom. When do I send my kid back to school?
Well, if you go by kind of the school, it's if they have a fever, they need to be 24 hours without a fever. It's a little bit different with the flu because it's a virus versus a bacterial infection where you get an antibiotic. So a lot of times they're like, oh, once they've been on antibiotics for 24 hours, send them back to school, but we're not giving antibiotics. You can get Tamiflu, but for that you need to get it within 48 hours of symptoms coming on to even decrease just the days that you're going to have the flu. So it's a little bit different. So I usually, with the flu, you're going to be more looking at symptoms like, are they able to go back to school? You know, my son had the flu and he slept for 3 days. Well, even though he didn't have a fever after 24 hours because he spiked a fever, we gave him Tylenol, it went down, but he's, he felt horrible. He felt horrible. And I don't want him around other kids sneezing and coughing or just feeling like, crud at school and not participating in class and kind of just, not getting the benefit of being in school.
I think it's probably the same for the work environment. At what point do you stay home? It's funny because when I've talked to a lot of people recently, because I have people all the time, clients and things like that, they're like, oh, I'm fine, I just have a cold, or I feel like I have a sinus infection. Wow, my allergies are really bad. And do you get a lot of that?
Yeah, it's hard to tell with a lot of things, especially this time of year. We're seeing some of the allergies come out during the winter and change of seasons. So you have the cough and cold from that. Again, I think you just have to look at the symptoms. Whether there's a fever or not is going to be a big telltale sign between the flu and, like having allergies. But, we still have to go back to that. Wash your hands, drink plenty of fluids, maybe wear a mask. I mean, masks don't hurt if you're sick to wear a mask so that you're not, spreading all the germs.
It makes so much sense. I have the silliest question, but I've always wondered this. Stuffy nose, Afrin over time, not great or anything like that. What do you recommend? Are there natural ways that you can sort of decongest yourself, for lack of a better word?
Well, sure. I mean, there's a couple of things like drinking plenty of fluids is the best way to break up mucus. Fluids, even if you take Mucinex, you want to have fluids with it. There is the nasal rinses, which are really good, especially for allergies and things like that you can just rinse the nasal. It doesn't have any medication in it, anything like that. So you're really kind of naturally doing it. Along with there's natural remedies. Some people take things like fire tonic to kind of just burn it off.
Love it.
Those are just kind of off-label kind of ways to do it. And then there's just sleeping with a humidifier.
I was just going to say homemade noodle soup.
Just like things like that can break everything up. But then again, you have to be careful with your steroid nasal sprays that are over the counter. Afrin you can't use for more than 5 days in a row. You'll get rebound congestion. So just talk to your pharmacist. Come to us. We have a lot of cool natural remedies in the pharmacy.
You have amazing things.
We have herb room, herbals. We have other stuff. So, you know, if you have any questions, you know,
come
just
see
call
Cathy
me.
Ulmer. Ulmer Pharmacy. Cathy, as always, thank you for joining us, and we'll be right back here on Carolina Women.